another thing is the anxiety and whatnot causes us to kind of get a little bit more do some what we call bruxism, which is grinding our teeth. But sleep apnea itself can cause grinding of teeth, because when you're not getting enough oxygen, your body goes through a fight or flight response and gets anxious, and we tend to clamp down our teeth and kind of grind forward, creating, in a sense, our own mandibular advancement if we're not wearing a CPAP or oral appliance. And so a lot of people say, well, I sleep with my mouth open. How am I grinding my teeth? Well, that's an indication you have sleep apnea and you're doing that grinding forward pattern. Most of patients who have TMJ issues and show bruxism, wear and tear, show more wear and tear on the lower anteriors as opposed to grinding left and right. They're grinding state. So they're very much correlated. And as a dentist, we tend to make them a night guard, right? An occlusal splint, perhaps make sure that the splint has a flat plane, so at least they can still grind forward and not cause them to stop with an anterior kind of stop there. So if they're not interested in checking out their sleep through a sleep test and maybe ultimately getting an oral appliance or a CPAP, then at a minimum we make them to protect their teeth a hard splint that allows them to still grind forward and not prevent them from doing that when they go through an apneic event.
And now, is this part of your every patient questionnaire when they come in as either a new patient or recall, is asking questions about their sleep history?
Yeah, there's problems, concerns, any sensitivities, and then it's how well do you sleep at night? And they could tell you I sleep great, and they're sitting in their chair. Well, excuse me for saying this, they're overweight or obese, and you can almost hear them struggling while they're awake. They're almost like doing like a snoring sound, and they're not going to always be truthful. You see their tongue in their mouth, it's ginormous. You barely can see the airway. They're Mallampati 3 or 4, tonsils are huge, lower anterior wear, dry mouth, tartar all in the front there. And you still have to, I think, open your eyes and open your mouth and your heart, Eric. It's so important to just say, hey, this is what I see when I have you laying back. I see the tongue kind of collapse back. If you ever have been told, or will be in the future, you're told that your bed partner says you stop breathing, or you snore too much, or you're tired throughout the day, I can help you. And then just I move on. If they're still not into it, they'll usually come back 6 months later and be like, hey doc, remember when you were telling me about that? My wife's telling me, or my husband's telling me that I'm snoring a lot more now. What can we do about that? They may not tell you right then and there. And then of course the other question is do you have any jaw discomfort, any popping, clicking of your jaw? Those are standard questions asking about sleep and TMJ at every recare or recall appointment and for every new patient.